In the future for hyperhidrosis treatment options, I would like to see products that act locally versus systemically. So it would have a lower side effect profile because you're using that product only on the areas that you're affected with hyperhidrosis. And I would also like to see products that are affordable, that insurance does cover, and that I don't have to jump through a bunch of loopholes to get the medications that I need for a better quality of life. The financial burdens associated with hyperhidrosis treatment include finding a doctor or a specialty doctor like a dermatologist who is familiar with hyperhidrosis, and then your insurance coverage. Your insurance may cover the office visit, but then when you get around to the prescriptions, depending on the class of medication, whether it's an oral medication or a topical medication, some of those may not be on the insurance company's formulary list, which then requires a prior authorization from the doctor faxed over to the insurance company. If it's a medication that's newly FDA approved, that can take a lot of time to get covered. So again, you're into that prior authorization process, the letter of medical necessity, things like that. So most people aren't willing to fight with insurance companies or go through that lengthy process. They just want treatment, and it can be very discouraging when the insurance company refuses to cover it because they think it's cosmetic versus an actual medical necessity. Hyperhidrosis is not a cosmetic problem. It's a physical problem that manifests in a physical way, and it affects people's quality of life. So getting insurance to understand this condition and getting doctors to be able to prescribe the right medications for the right patients at the right time is crucial. I've spoken with people who have actually stopped their hyperhidrosis treatments, either due to insurance no longer covering it because they would only cover X amount of treatment sessions for botulinum toxin, for example. So the other option is to pay out of pocket for those injections. And when you're going in every 6 to 9 months and spending at least $1,000 for those injections, that's not very, cost effective. Some people that I know travel out of state to a dermatologist who administers these injections in their office. So not only is this person taking time off of work, but there are travel expenses involved, hotel stays, office visit copays, and then paying out of pocket for those injections. So it can become so expensive that people would rather live a sweat-ridden life than go into debt over this condition.